Hello, welcome to my channel. In today's video, I will tell you about attention deficit hyperactive disorder. Attention deficit hyperactive disorder is a neurodevelopmental disorder. As we know, neurodevelopment disorders start from birth to 5 years of age. But, before we start, please subscribe my channel and hit the notification bell. Thank you. So, let's start with a brief introduction. Attention deficit hyperactive disorder, shortly called ADHD, is one of the most common childhood neurodevelopmental disorders. It is typically diagnosed in childhood and can last into adulthood. Children with ADHD may have difficulty paying attention, controlling impulsive behaviors, acting without considering the outcome, or being overly active. Symptoms of ADHD. It is normal for children to have difficulty focusing and behaving at times. Children with ADHD, on the other hand, do not simply grow out of these behaviors. The symptoms persist, can be severe, and can cause problems at school, home, or with friends. A child who has ADHD may a lot of daydreaming, forget or misplace things, squirm or fidget excessively, make careless mistakes, or take unnecessary risks. Have difficulty resisting temptation, have difficulty taking turns. Have trouble getting along with others. Types. There are 3 types of ADHD, depending on which symptoms are the most severe in the individual. Predominantly inattentive presentation, the individual finds it difficult to organize or complete a task, pay attention to details, or follow instructions or conversations. The individual is easily distracted or forgets daily routine details. Hyperactive impulsive presentation, the individual fidgets and talks a lot. It is difficult to remain still for an extended period of time, example, for a meal or while doing homework. Smaller children may constantly run, jump, or climb. The person is restless and struggles with impulsivity. Someone who is impulsive may frequently interrupt others, grab items from others, or speak at inappropriate times. It is difficult for the individual to wait their turn or listen to directions. People who are impulsive may have more accidents and injuries than others. Combined presentation. Both types of symptoms are present in the person. Because symptoms can change over time, the presentation may also change. ADHD risk factors. Scientists are researching the causes and risk factors of ADHD in order to find better ways to manage and reduce the likelihood of a person having the disorder. Although the causes and risk factors for ADHD are unknown, current research indicates that genetics plays a significant role. Recent research has linked genetic factors to ADHD. In addition to genetics, scientists are investigating other potential causes and risk factors, such as brain damage, environmental hazard exposure, for example, lead during pregnancy or at a young age, pregnancy alcohol and tobacco use, premature birth, birth weight is too light. The popular belief that ADHD is caused by eating too much sugar, watching too much television, parenting, or social and environmental factors such as poverty or family chaos is not supported by research. Of course, many things, including these, may aggravate symptoms, particularly in certain people. However, the evidence is insufficient to conclude that they are the primary causes of ADHD. Diagnosis. Determining whether a child has ADHD is a multi-step process. There is no single test for ADHD, and many other problems, such as anxiety, depression, sleep problems, and certain types of learning disabilities, can have symptoms that are similar to ADHD. A medical exam, including hearing and vision tests, is one step in the process to rule out any other issues. Physician discussing treatments with family. ADHD is usually best treated with a combination of behavior therapy and medication. Behavior therapy, particularly parent training, is recommended as the first line of treatment for preschool-aged children, ages 4 to 5, with ADHD before medication is tried. What works best for the child and family may vary. Close monitoring, follow-ups, and making changes as needed are all part of good treatment plans. Staying healthy while managing symptoms. Being healthy is important for all children, but it is especially important for ADHD children. A healthy lifestyle, in addition to behavioral therapy and medication, can help your child cope with ADHD symptoms. Here are some healthy behaviors that may be beneficial. Developing healthy eating habits such as eating plenty of fruits, vegetables, and whole grains, as well as selecting lean protein sources. Participating in daily physical activity in accordance with age. Limiting daily screen time from TVs, computers, phones, and other electronic devices. Getting the appropriate amount of sleep each night for your age. Obtain assistance. If you or your doctor are concerned about your child's ADHD, you can take him or her to a specialist such as a child psychologist, child psychiatrist, or developmental pediatrician, or you can contact your local early intervention agency for children under the age of 3, or public school for children 3 and older.